Hello and welcome to the presentation. My name is Jason and I work for a healthcare consulting firm that partners with your employer. Together we work with your employer to make certain employee benefits insurances available to associates of your company. And what we've been asked to do is put together a brief summary slideshow of what's available for 2018. And so that's what we have here. I'm going to take you through some slides and give you some narration along with commentary along the way so that you are informed as to what is available in 2018. If you have specific questions related to what's covered and what's available, please refer to the materials provided to you by Human Resources or get in touch with them to answer any questions that you may have. For many of you watching this presentation, you are in your company's annual open enrollment period. The policies inside this presentation all renew on January 1st, and so their coverages are effective on January 1st. So this is your opportunity to enroll or make changes to your enrollment. The window of time for you to make your decisions is shown here as November 27th through December 14th. If you are a new hire to the employer and therefore newly eligible, you'll have your own specific enrollment deadline and window of time in which to make your decision. So, what's changing for 2018? If you were previously on the plan in 2017, you'll recognize that there are no changes. No changes to the Geisinger Medical Plan, no changes to the Sun Life or Assurant plans, and no changes to the employee contributions. This is certainly welcome news for those who are on the plan previously. So who's eligible to enroll? Active full-time employees are eligible, and for those employees who enroll in coverage, they can also add their legally married spouse and children up to age 26. Now, changes during the year. Outside of open enrollment, you need to have a specific qualified life event in order to make a change to the way you're enrolled. So it's important for you to understand during open enrollment, you're making a 12-month decision or commitment to either be enrolled in the plan or to not enroll. If you want to make changes during the year, you're going to need one of these listed specific events to happen, like a marriage, birth of a child, those kinds of things. If one of those happens, then you'll have a sort of a mini open enrollment just for that one event where you'll have a 30-day window to make changes during the plan year. Otherwise, you'll need to wait for open enrollment next year to make changes that would be effective in 2019. Okay, so let's get into the health plan summary. The health insurance product is provided by Geisinger Health Plan. There is an individual deductible of $1,000 and a family deductible of $2,000. One thing that's important to understand is that if you do have family coverage or even employee spouse or employee child coverage, no person in the household would go over that $1,000 individual deductible. So if you and a spouse or you and a child both have medical needs, no more than $1,000 can come from any one individual in the household, and you're capped at $2,000 for your entire household. That's how the family deductible works. If you go out of network, there's much higher deductibles that you'd be responsible for, $7,000 per individual or $14,000 per household. So you definitely want to use in-network providers whenever possible. There is a plan year maximum out of pocket. The plan year max out of pocket includes the deductible. So what we're looking at here is if you have deductible expense plus all of the copays that we'll see here in a few moments, if some combination of those gets you to the $6,600, then you're going to be shut off and the plan will begin paying 100%. You'll have no additional costs. So that maximum out of pocket is really your worst case scenario, all in highest responsibility under this plan. But keep in mind, it includes the deductible, and you'd have to have a whole lot of copays for you to ever get it $6,600. In the outpatient care section, you'll see that there is a primary care physician copay that is also split into a PHN office visit. That PHN office visit, what that is if you were to designate a primary care physician as your primary care doc and use that physician, you'll get a lower copay of $20. Any other primary care office that you would choose to use would be at the higher copay of $30. Specialists are shown there as $50. This is a preferred provider organization type plan, so that means you do not need to have a referral to go see a specialist. You can self-refer and go see a specialist as you deem appropriate. You can see there that the well child immunizations and routine physical and routine other items are covered in full, and the surgical and hospital expenses, diagnostic lab and x-ray, those are covered in full but after the deductible is applied. For inpatient care, your deductible will apply first, and then the plan will pay 100%. You're paying 0% after you've satisfied the deductible. If you use the emergency room, it's a $125 copay and a $30 copay for urgent care. Keep in mind that those copays are just for showing up and accessing the emergency room or the urgent care facility. Whatever they do to you in that setting, stitch your arm, treat a bruise or a burn, reset a broken arm, things like that, those are going to be deductible expenses and will be in addition to the copay. It's always our recommendation that you would consider using urgent care over and above emergency room, because not only will you have a lower copay at $30 instead of $125, but whatever they do to you in the urgent care setting is generally lower cost and will cost you less of your deductible than the same procedures done in an emergency room setting. The emergency room is the most expensive place in our healthcare system for you to get anything done to you. That said, if it's an emergency and life-threatening or something that's not going to be able to be handled in an urgent care, by all means, go to the emergency room and get the care you need. Maternity care, you can see that that's covered in full after the deductible. Inpatient mental health care is a specialist copay. Outpatient would be covered after the deductible. The prescription drug program, you have a series of copays shown there. If it's a generic drug, a 30-day supply is going to cost $10. A formulary drug, so that'd be a drug that's on the list of brand medications that's set forth by Geisinger's health plan. Those drugs are a $35 copay. Those are generally higher cost drugs compared to generics, so they have a higher copay. There's also non-formulary drugs, so they're not on the preferred list or the formulary, so they're higher cost, and therefore it's a $55 copay. If you have specialty medications that are injectables or infusions, it's a $150 copay per injection or infusion. Or if you're out of network, it's a 20% coinsurance. And the mail order program is also illustrated there. Essentially, you can get a 3-month supply delivered to your home at the cost of 3 copays. You also have a wellness program that is layered in with your Geisinger health plan. It's important to note that at this time, because your participation in the wellness program will influence your medical plan payroll contribution rates. Now, this program is going to require an initial biometric screening in the spring and a follow-up screening in the fall. Specifics about those will be released at the appropriate time, but for now it's important for you to understand that your participation in that wellness program will have an impact on your future contribution rates. Additionally, if you are a tobacco user, there will be a tobacco surcharge added to your payroll contribution. So now let's take a quick look at the payroll contribution rates. There are both weekly and bi-weekly payroll contributions shown here because some of your company's divisions are on weekly and some are on bi-weekly. This information would have also been provided to you by your human resource contact. But please note the differences between the preferred, enhanced, and standard tiers. Those are the wellness program tiers that I referenced on the previous slide. And then with each of those tiers, there's either a non-tobacco or a tobacco rate. The tobacco rate includes the surcharge that I mentioned on the previous slide. Your employer makes available to you 2 dental insurance programs. They're both provided by Sun Life, who was previously known as Assurant, and there's a high and low option, so you'll get to pick among those 2 plans. Both are based on a reimbursement of in-network or out-of-network charges, and that'll be based on reasonable and customary. So you're definitely going to want to use an in-network provider as much as possible because they have agreed to accept Sun Life's payment terms. If you bounce outside of the network and use a dentist who does not accept the insurance, you may end up with balance billing because the plan is going to pay at the reimbursement rate that it would have paid if you used an in-network provider. So you could be responsible for balance billing from that dentist. So you have an incentive to use the network. You're also getting the lowest costs that you could possibly get by using in-network because those dentists have agreed to take Sun Life's reimbursement rates. As we'll see on the next page, both plans have the same annual calendar year max of $1,000, and they have the same levels of deductible, $50 per person, not to exceed $150 per family. All right, so let's get into some specifics on the dental products that are available. You'll see here we have a summary of the high plan and the low plan, and we're showing you the in-network and out-of-network reimbursement rates. As mentioned on the previous slide, the plan year deductible and the plan year maximum, as well as the out-of-network payment terms, are the same between the high and the low plan. As we drop down into the co-insurance section, you'll also notice that the preventive services, things like exams, cleanings, and bite wing x-rays, are also covered the same way between high and low, where the plan pays 100% in network. The basic services and the major services is where we start to see a difference between high and low. In the high plan, basic services like fillings and simple extractions are going to get covered at 90%, where you pay 10% if it's in network, and out of network it's paying 80% of what it would have paid at the in network level, and the members paying 20% plus any overage that was not covered by that in-network allowance. That's called balance billing from the dentist office. In the low plan, it's covering 60% of the basic services for in-network and 50% if you're out of network. And again, that's 50% of what the plan would have paid if the dentist was in the network and accepting the reimbursements. In the major category, things like crowns, major extractions, oral surgery, you're getting 60% coverage on the high plan in network, 50% if it's out of network, and the low plan drops down to 10% coverage on those major items if you're in the network, and 10% also out of the network. You'll see that orthodontia is not covered by either plan, and there is a waiting period. So the first 12 months that you are enrolled on the plan, you'll be waiting to have the coverage for oral surgery, crowns, dentures, and bridges. Once you've been on the plan for 12 months, that waiting period will drop off and that coverage will activate for you. And here are the dental plan payroll contribution costs. We're showing you the weekly and the biweekly costs for both the high and the low product. The Vision Discount Rider. This is provided as a bonus feature for enrolling in either of the dental plans. So you get this if you take the high plan or the low plan. It comes along with it, and it gives you access to a large network of vision care providers where you'll receive discounts on eye exams, frames, lenses, and contacts. Employer-provided life insurance and accidental death and dismemberment coverage. This is provided through Sun Life as well. Your employer is paying this premium, and all full-time associates will get this coverage whether they sign up for it or not. It is covering you at $10,000 worth of face amount life insurance and also a $10,000 accidental death and dismemberment feature. And again, paid for by the employer, and make sure you name a beneficiary. In addition to the employer-paid life insurance, you have the optional choice of adding voluntary life and accidental death and dismemberment coverage. This is supplemental and in addition to the employer-paid life from the previous slide. It has a guaranteed issue of $150,000 of benefit or face amount, and that guaranteed issue is only available to you at your initial eligibility date. So that means if this is your first time being eligible for the product, you want to think a little harder about this, because at this moment you have the opportunity to add up to $150,000 worth of life insurance without having to give a statement of good health or fill out any health questionnaires. You're guaranteed to get up to that amount with no questions asked. Now, if this is not your first time being offered or your initial eligibility, you do still have the option to increase your amount of life insurance by $10,000 up to the guaranteed issue amount without completing a health statement. So if you previously enrolled in, say, $50,000 worth of coverage, you can add another $10,000 during open enrollment without completing the health statement. Now, if you would like to have more than the $150,000, that is available, but you'll have to complete a health statement, and it will need to be approved first before that coverage becomes effective for you. We have an example shown here of a weekly premium for a $100,000 face amount benefit for an employee aged in the age bracket of 30 to 34 would cost $3.60 per week. And coverage is also available for your spouse and children. Please refer for more specifics on the pricing for both employees, different age bands, and for the spouse and children. Please refer to the information that your Human Resource Department provided. Short-term disability coverage. This line of coverage is paid for by your employer, so you have this whether you elect it or not, and it is going to provide coverage to you for your lost income due to an off-the-job accident or sickness. Remember, on-the-job accidents are workers' comp, so this is meant for you to have protection when you're off the job. So how does it begin? If you are injured due to an accident, benefits will begin on the first day due to an accident. However, if it's a sickness, the first 7 days will not be covered, and the benefits will begin on the 8th day due to sickness. The plan is going to cover up to 60% of your pre-disability pay. That's up to $800 weekly maximum. So it will provide a benefit of up to $800, but not to exceed 60% of your pre-disability pay. And that benefit is payable for up to 26 weeks. That 26 weeks, if it's for a sickness, will include that first 7-day period. So if it's a sickness, it's going to be 25 weeks of paid benefit. You also have the option of adding voluntary long-term disability. Long-term disability is designed to be a supplement to the short-term disability coverage. As mentioned on the previous slide, the short-term disability is going to give you 26 weeks of protection. But what if you have an injury or a sickness, some sort of disability that is prolonged and goes past the 26 weeks? That's where you have the choice of adding voluntary long-term disability. It's going to be paid for by the employee, which means it's voluntary. It covers your lost income due to an off-the-job accident or sickness beyond the short-term disability policy. It's going to give you benefits after that 6 months of disability that were covered by the short-term disability policy. You get to choose the monthly benefit. You can pick it in increments of $100. You have to buy at least $500 worth of protection, and you can go up to a maximum of 60% of your pay or $5,000, whichever is the least. The benefit is generally payable for up to 5 years. There are certain conditions and limitations on that 5 years worth of benefit, but in most cases, you're going to get 5 years of benefit if you continue to be disabled. The Healthy Solutions benefit is offered by Sun Life through a company called Healthy Solutions to those who enroll in either the voluntary life insurance plan or the voluntary long-term disability plan. You can enroll in one or the other, or if you're in both, this is available to you. And what you get to do is choose from one of the benefits listed below. Essentially, all of these are discount programs that are made available and get you some savings on the various covered services. Please refer for more detail to the handout available from Human Resources. So here's a quick checklist. What you'll need to do at this time is review your current elections if you're already enrolled. Make sure to check and update any of your personal information. Then choose your benefits for the coming year. If you have any questions, please contact Human Resources. They'll be happy to answer your questions related to these benefits. And remember to complete your enrollment form and submit by your due date. That's December 14th for open enrollment. If you're newly eligible, then there's a specific deadline that was provided to you. Make sure to get your paperwork back into Human Resources by that deadline. Thank you for taking the time to watch this video. I hope it was helpful and beneficial for you to understand what's being made available in 2018.